I recognize Manager Jones for a motion.
I move that the board amends the Central Health FY 2024 budget resolution by inserting the following language where appropriate and renumbering accordingly. Provide funding to community care for a total not to exceed an amount of $500,000 to support increased operations at the Men's Health Clinic. Black Men's Health Clinic, did I say? Thank you.
Okay, I have a motion. Do I have a second? I have a motion from Manager Jones. I have a second from Manager Valadez. Any further discussion? Manager Musaidi.
Thank you. Manager Jones, I have a question, comment in terms of the no-show rate, which is about like 40%. So is there a plan to address the no-show rate?
Yes, I'm not sure exactly about those numbers, but I'll take your word. The no-show rate has been, as I've mentioned at our last meeting, is the challenge of being able to get men of color particularly, who are working, those who are not working, to be able to show up on a particular date at a particular time, given certain criteria. And so by enhancing additional dollars from Central Health to community care to be able to do this, we will have more days available for them to be able to be seen and to be able to be served at those clinics.
So why are they even scheduled on the calendar if they're not able to make it?
Well, they're scheduled because they anticipate being there. But life happens, and as a result, they are not able to make it for whatever reason.
So has there been any kind of initiatives or of reaching out, calling the patients, a survey, like why you have not been able to be seen? You missed your appointment?
Well, a couple of things. One is there are outreach efforts out there to, one, build up the capacity. Once those capacity are built up, then they do follow up with them to see if they can do it. The question is, the program has only been funded for a year now, and it hasn't been funded the whole year. And so they're getting there, but in order to sustain successful operations, they really need this foundation funding to be able to build upon that.
I understand. I'm not questioning. So I know that's something that we both talk about. How do we close the gap and address the health disparities? So there's two pools of patients. There's the existing patients who need like follow-up. How are those managed different than other patients that you're trying to reach up to engage into your clinic? So is there a plan to really keep them to continue their care for those patients who are already existing, who have other comorbidities? I think they've highlighted hypertension as one. How do we manage them? Are they coming? So is there efforts? I know there's a good outreach. So I just wanted to know, we want to close that gap.
Yeah. Well, yes, there is an effort underway currently to maintain the caseload that they have, build upon it, utilizing them to help build that. Additionally, is the ability to make sure that any new and additional clients that are coming in are being able to be seen timely, to be able to be managed timely, and to make sure that they are being seen by the appropriate staff. Now, remind you, this is just the beginning. This is a first effort to try and begin to get resources built there. This initiative is something that I think will go a long way to addressing those things that we've been talking around here, and is particularly an equity effort. So to answer your question, yes, there are programs currently underway to manage those that they have. But many of those are the brothers, the cousins, the nephews, or others who cannot get in because they're only there one day a week. And if the doctor's not there, then they have to reschedule. If their provider's not there, they have to go someplace else. So yes, the answer to that is yes.
So I hope, if this motion passes, that by next year that the numbers are different, that we're able to see more patients are continuing their care, so there's efforts, the no-show rate is reduced significantly. So that is my hope and anticipation.
Well, I would agree with you, but I think that if we look at the no-show rate of other patients in other facilities there, this may be a little higher. It's new. It's been around, community care has been around a while. So the goal is to be able to get this population up to where the other ones are, recognizing that the other ones are not perfect either.
Thank you.
Any further questions? Manager Martin?
Yeah, I just wanted to thank you. I wanted to have something clarified to me because last meeting we had, our COO told us that there are ongoing rolling funds for community outreach. I believe, and that $286,000 will continue on a year-to-year basis for community outreach. And I guess one clarity, is this extra funding to fund for subsidization of physicians if they go there and don't see patients as we discussed last time, or is this just a lump sum to continue more outreach?
No, this is money to be able to hire clinicians,
Just physicians?
clinicians, maybe nurse practitioners and others to provide services there.
Okay.
Currently, they're not being provided with the funding that currently goes there. It's outreach.
Okay, thank you. So because last time we discussed it, this would be a thing to try for the year to, because I agree with you, you have to extend the hours these people work. They have, things happen,
Right.
as you say. But that this money essentially would go to subsidize essentially community care for the physicians go there. They maybe see 2 people instead of 20, and that we'd still subsidize that. Is that what the money is for?
Exactly.
Okay,
To be able to
thank you very
augment that,
much.
yes.
Thank you. Any further questions? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Motion carries unanimously.
Thank you.